Okay, so my dear colleagues, the host and members of the public global community, Dr. Ressa, my Dr. Castle has just introduced me, and my presentation is on the impact of COVID-19 pandemic on education of people with disabilities in Kenya. I'm focusing specifically on primary schools and secondary schools, just because these are the primary areas that really decides the future of an individual, especially when it comes to people with disabilities. Now, before I continue, I just want to mention that Kenya is situated in Africa, but I personally am based in America. It's because I originally come from Kenya, but I'm also interested in transnational events affecting people with disabilities, specifically in education. And I do research in education, although I understand that education actually is the core virtually of every human realm, in that with education, you can determine your health, you can determine your employment, you can determine the kind of quality of life that you lead. So that's the approach that I have here. Now, this research generally is informed by situational analysis. So I'm more interested in understanding the position of disabled students in Kenya during COVID-19 pandemic. And the data that I collected mostly came from the Kenya Ministry of Education. It also came from the Kenya National Bureau of Statistics and UNESCO, UNICEF, the International Monetary Fund data, World Bank data, and the World Health Organization data. So I triangulated this data based on the sources where I retrieved the data. Now, what about disabled students population and disability prevalence in Kenya? So according to 2019 census, there is a population of Kenya about 48 million people. However, there is no clear population of people with disabilities in Kenya. However, using WHO population estimate, which is 15% of the global population of any society, there are about 7.1 million people with disabilities in Kenya. That translates to around 2.8 million children with disabilities in Kenya. Nonetheless, as I said, there is no clear government population data in Kenya. And for instance, in 2008, the Ministry of Education data showed that there is only 6% prevalence of children with disabilities in primary and secondary schools, which translated to 45,000 children. Out of the 2.8 million, you can tell that majority of children with disabilities are not accessing education, despite that Kenya is, as a member of the United Nations and having disability legislations and having embraced disability rights, including the National Convention of the Rights of People with Disabilities and the National Convention of Children, the population of children with disabilities still accessing education is very low for many reasons. One is because there is no clear data and therefore the government cannot plan for them. Secondly, is because there is limited resources and also mismanagement of resources. And the other reason is that the culture generally is relatively deficit oriented, in that people feel they should invest in non-disabled children rather than children with disabilities, especially when it comes to limited resources. Now, so my findings with the impact of COVID-19, we know very well, like any other country in the world, Kenya did close schools as a mitigating factor. However, it did that at the time when already 40% of the population live in poverty, and at the same time, majority of children are out of school. And so COVID-19 has only exacerbated the problems of education. Apart from clinical problems, which is illness, the education system affecting children with disabilities is relatively related to inadequate digital infrastructure and also shortage of technically trained teachers, according to the data that I got from different sources. So inadequate digital infrastructure, generally, this is related to limited digital devices like computers, internet, electricity, water, and many other infrastructural related factors like transportation. If anything, the government did close down traveling starting March all the way through August, actually. And that actually limited transportation of a few digital devices that are available, and also limited transportation of PPEs, for instance. Now, the other problem that is affecting the education of children with disabilities is the shortage of technically trained teachers. Now, it's quite ironical that that Kenya has many trained teachers who are unemployed, qualified teachers, and I'm saying qualified but not highly qualified. So qualified in the context that they have the pedagogical skills to teach. Nonetheless, the majority of these teachers are also computer illiterate, and therefore they are not pedagogically prepared to teach online. Now, besides that, most of the teachers, Kenyan teachers, are employed by the government, so they are government employees. And because the government has been following the International Monetary Fund advice and World Bank advices, they have been limiting employment of teachers to reduce the government wage cost. So there is always a competing factors here in that the government is interested in empowering the populace through education, but at the same time, being the main employer of teachers and being controlled by international monetary organizations like World Bank and IMF, is always trying to balance the interest of different people. So it has the interest of the citizens, and then it has the interest of the international community who give loans and those other related funding resources. So inadequate digital infrastructure is a big problem, and shortage of technically trained teachers is also a big problem. Now, my argument is that despite these being the problems, COVID-19 has created an eye-opener for us to see the disconnect of the government, the people, and the international community. Because so far right now, since Kenya implemented universal education in 2003, it has been virtually signing most of the international treaties, including the United Nations Vision 2030, which is poverty eradication. So all of a sudden, this COVID-19 has just come up, and now it has created another problem, which is relatively going to impact the achievement of UN Vision 2030. So education, we understand, is very much instrumental in the empowerment of people, including those with disabilities, and especially in this digital era of neoliberalization, globalization. Now, I'm proposing in this article that the way forward to address the needs of children with disabilities and to ensure that Kenya achieves Vision 2030, irrespective of the current circumstance, is first of all, to make sure that children with disabilities and their families are considered as part of the collective healthcare security. And therefore, any provision of COVID-19 mitigating factors, including PPE vaccines, should also prioritize them. And I'm talking this from experience that, like even in America, when COVID started, actually there were many hospitals that were sending messages that they will be practicing triage, in that they will be selective. They will only be treating those they suspect will be more likely to survive, though that later on changed as time went by. Now, so I'm calling for the government of Kenya to have the same approach, collective healthcare security, in that it should target virtually the whole population without necessarily discriminating based on disability. Now, secondly, I'm proposing what the United Nations has already proposed, the disaster education. So that is missing in Kenya. Disaster education has never been implemented holistically in the schools, unlike many other countries. Let's say, I read about an article by Krishna, who wrote about disaster education in India, for instance, when it comes to dealing with floods, for instance. Yet we experience the same disasters in Kenya. We have, let's say, we've been dealing with COVID-19, we've been dealing with locust invasion, we've been dealing with drought, we've been dealing with floods. So all these disasters have not been considered in the schooling. Yet doing so, research shows that really prepares people mentally, physically, psychologically, and people who are more prepared for disasters tend to recover very much easily from the disasters. So including disaster education in the curriculum is so critical. And then involving children with disabilities and their families in disaster recovery process itself is critical. And to achieve that, there is also need to invest in digital infrastructure. So for instance, Kenya hasn't invested very much in digital infrastructure, and it took actually Google to come in and many other organizations to come in, just because the digital infrastructure, especially in the rural areas, is so inadequate, in the context that in many other countries, low-income countries like Kenya, majority of the population live in the rural areas, and the rural areas tend to be relatively less developed. And because of that, it tends to disadvantage the most disadvantaged community members. And in this context, it's children with disabilities. So improving digital infrastructure is key to addressing implementing disaster education, and it's also key in improving collective healthcare security. So I'm proposing in this paper that overall, students with disabilities should be at the center of disaster education, and also they should be at the center of the government investment in education.